let's get to this next one. I don't have a fun transition for everybody today. I tried to think of one, as many as I possibly could. Dr. Fauci, making news, making headlines with some very eyebrow-raising comments. First of all, strange question, speaking of the media saying, Dr. Fauci, can people gather for Christmas? Well, hold on a second. It's October. Also, we have this vaccine. You might have heard of it. Why are we even asking this question? So she asked the question, tease it up for the good doctor. Here's what he had to say.
We can gather for Christmas, or it's just too soon to tell?
You know, Margaret, it's just too soon to tell. We've just got to concentrating on continuing to get those numbers down and not try to jump ahead by weeks or months and say what we're going to do at a particular time. Let's focus like a laser on continuing to get those cases down. And we can do it by people getting vaccinated, and also in the situation where boosters are appropriate to get people boosted, because we know that they can help greatly in diminishing infection and diminishing advanced disease, the kinds of data that are now accumulating in real time.
Too soon to tell. Last time I checked, it's not December 2020, it's December 2021. And you might actually ask, what was the point of getting the vaccine? And as you point to, as actually even alludes to, even if, so let's say you're worried about the elderly, well, they can get a booster shot if they want to, and then they have, whatever, 90-something% protection, especially already 100% protection against hospitalization and death, 99.99. And then whenever it comes to protection from actually getting it, the booster at least, seems to be working in some cases for the elderly, and that's if you're elderly. For everybody else, if you're vaccinated, you pretty much don't have to worry. I just think that if you look at this level of hysteria and this level of control here where Fauci is pushing for, you get to a point where COVID-0 is the de facto policy of the US. And that is not possible, people. It is an endemic disease at this point. Fauci himself actually, in an interview a day before, said something similar. They said, well, Dr. Fauci, what about the idea that COVID is endemic? And he said, I simply will not accept this idea that just getting COVID for some people is the norm. Now, okay, his job is to be, public health, disease, or whatever. But his job is to advise the president. He's not actually supposed to be running the policy of the government. The problem, I think, the biggest problem, in my opinion, for the Biden administration has been that these public health people have made COVID-0 now the de facto policy of the government. You can't have that possible. We don't have a flu zero policy. And yes, I know that sounds like Trumpian or whatever, but here is the truth. With vaccines, they are much more analogous now. It is not, nuking our elderly people and people who are obese. You have a protection. If you don't want it, okay, that's on you. And now there are public health measures in place in order to try and incentivize that to as much as possible. But at a certain point, we just have to say, we have the policies in place. We've pushed it as far as we possibly can. Everybody's got the protection if they want to have the protection. And if you get COVID, okay, it happened to me, breakthrough case, sick for a couple of days. I'm not going to lie, it definitely did suck, but it's over now. And that's just simply going to be the reality for a lot of people in our society. I just think that this type of December of 2021 saying that you may not be able to gather for Christmas is total insanity.
I mean, there's a couple things here. First of all, I was surprised by the question.
Yeah, exactly.
Like that. I would never ask that.
Right.
And then there's a really simple answer. The answer is, if your adults are vaccinated, then you're good. You're good.
And if you're really worried, go get a booster shot.
Yeah, absolutely. I mean, that's it. Like that, we already know that. We know how the vaccines work. We know they're effective. I mean, sure, anything crazy could happen. There could be a new variant that, it jumps the vaccine. No, as far as we know, right now, the vaccines work. And if you're vaccinated, don't worry about it. You're good to go, right? I mean, there's minor risk in so many things that we undertake. But if gathering as a family at the holidays is important to you and you're vaccinated, do it. You're good to go. So it's a really simple, straightforward answer. And the other thing that I think this exposes is who's going to listen? I mean, no one's going to listen to this guy.
That's the worst problem.
This is so disconnected from the reality of how people living outside of a small handful who are really into their pandemic era restrictions and have really embraced this and have the Fauci signs in their lawn and whatever. That's a pretty small percentage of the population ultimately. Most of the population is not living in a way where they were even questioning, should we get together at Christmas time? Should we gather for Thanksgiving if we're all vaccinated? And so it's just, the more disconnected they get from how people are actually living their lives and thinking about this disease at this point, the less credibility they're ultimately going to have. And then I do think that as you were pointing to, there's a connection here with the Biden administration hasn't made really clear what their goal is.
Yeah, what is the policy?
So that allows Fauci and other public health officials to sort of freelance and assert for themselves what they think the goal should be. And I think you're right that the way that Fauci's been talking, it's like a zero COVID type of ambition. But even New Zealand, that they were famously trying to do, have
and
a
Australia,
zero COVID policy. And, they have a lot more going for them in terms of being able to achieve that than we do with a much smaller population. They've said this is not workable. This is not possible. So because Biden hasn't been clear about here's what we're aiming for and here's our idea of what would be acceptable, it allows Fauci and others to kind of freelance and assert a more sort of aggressive, more frankly radical notion of what we should be shooting for here. And again, you always have to look at what are people's incentives in these situations. And for Fauci to be at the center of the national conversation, I mean, I'm sure that's been very elevating for him.
Sure.
He's now one of the most famous people in the country. So if the pandemic ends, well, then he's less interesting of a guy. He's not at the center. He's not getting asked on the Sunday shows all the time. And that's not to say that he's like thinking about that or just, nefariously crafting this towards his own ambition. But people are influenced by what's in their interest, whether or not they realize it. So that's always a good thing to keep in mind as you're evaluating public figure statements.
100%. And look, show me one news channel where you're going to hear this. COVID cases have fallen 35% since September 1st.
It's great.
35%.
Great news.
That is fantastic news. Does it justify asking Dr. Fauci, can we gather for Christmas? Maybe some questions on gain of function research, but hey, whatever. I just happen to be somebody who cares about these things. We do not seem to see any of this in our coverage. 35% drop in overall cases, hospitalizations too. And the 2-month cycle that we continue to see continues to happen. Every 2 months we see like an ebb and with the flow. It's unclear exactly what that is ascribed to. We don't know if that shows that Delta alone. We don't know if that's going to continue 2 months from now. So I'm not going to say like, hey, make sure that, we're good to go, or in 2 months that things could be bad. All it is to say is that there does seem, at least in Britain and elsewhere, that post-Delta, when you get several months into it, and remember we have a much larger population than Britain, so it was going to burn a little bit hotter. Same thing whenever it comes to our unvaccinated population. That cases have rather consistently fallen, even with the ebb and the flow. So even with the cold weather, and I'm beginning to feel that brisk fall air and more, even with all of that, it is entirely possible that we are on the tail end. And at the least of it, the news media does have a responsibility to tell people what I'm saying.
Yeah.
35% drop since September 1st. That is a different fact pattern, which requires a different response, which requires a different public consciousness. Not the same level of hysteria. I mean, look, even in early days of Delta, people were freaking out. I mean, I got COVID, right? Kind of at the height. People were really realizing that breakthrough cases are way higher than what was being publicly reported. Vaccine efficacy was being called into question, all of that, especially in terms of preventing infection. But now, if you think about the levels of natural immunity that we have, along with vaccine immunity, we are really getting up there in terms of our adult populations. And the drop in cases reflects that. So then public posture should reflect that from the government. And that is not what we see right now.
It's, again, a media story, too, about what their incentives are in terms of covering this story. Like, hey, guys, things are actually maybe getting a little better. Like, look, we want to be cautious and things can happen and maybe there's a spike.
Of course.
We don't know.
Yeah, maybe there'll be one.
Not ruling that out. But a 35% drop is a good sign and that should be reported. And I don't want to say that no one's talking about it or no one's reporting it. I think I saw the New York Times this morning put out in their newsletter about that there's been a decline in COVID cases. But it's not going to get these breaking news headline alerts on cable news because it's not as salacious. It's not as agitating. It doesn't bring in the views to say, hey, this thing is actually getting a little better. The same way that, going and and ginning up a lot of fear and a lot of anxiety around it, that's much more effective in terms of their business model. So it's their incentive, again, to emphasize the worst possible case scenario, the worst news that's coming out. And so you end up, if you're a person who's consuming a lot of that content, you can end up with a distorted view of where we actually are in this pandemic. And again, look, I'm not trying to downplay it. Like 700,000, I think, Americans
700,000
have died. A massive, massive number. This has been horrific. It's been the most deadly pandemic in American history. And it's not like the risk is over. But if you're vaccinated, you're in pretty good shape. We know what the numbers are. We know that they've been effective. Yes, there are breakthrough infections, but you are very, very unlikely to end up hospitalized or end up dead. That's tremendous news. The drop in cases is tremendous news, but it's not in their financial interest to really emphasize that part of the conversation versus the risks that still ultimately exist.
That's right.
Hey guys, thanks so much for watching.
That's right. Just as a reminder, you can become a premium subscriber today. Watch the full show completely uncut, our reactions to each other's monologues. You get to listen to it. You get to ask us questions, all that good stuff. Link is right there in the description or at breakingpoints.com.
Best of all, great way to say screw you to the mainstream media.